I actually had an individual in Pennsylvania. She took her daughter to the pediatrician, and the pediatrician accused her of abusing her daughter with trying to because she convinced her daughter that mold was causing the health problem. Turned the woman into the authorities for child abuse. Called everybody, like Dr. Shoemaker and me and Dr. Michael Gray and all of us who were interested in the subject matter and publishing on the subject matter, referred to us as quacks. That's how polarized this issue is in some areas of this country. The woman has never met me, never met Dr. Shoemaker, never met Dr. Gray, this pediatrician. How does she know we're quacks?
Sure. Well, it's a sad commentary, too, on the state of the Department of Child Services in this country. It just really provides immunity to prosecution for any expert witnesses, and allows this whole system to really be perverted. And children are, I mean, obviously there are some cases where it needs to be implemented, but there's a large number of cases, and perhaps even the majority, where there's no problems going on at all. And
I agree with that. I've been thinking about this quite often. I was raised with a very strict father who had a razor strap. And the only time he ever used that razor strap on us was when we caused problems. I mean, the problems we caused today would probably put the children in jail, you follow?
Sure.
But my dad would just look at me, grab the razor strap, and whap me across the butt with that damn thing, and I didn't do that particular thing again.
Sure.
Okay.
There's certainly that's an appropriate use of discipline, but there's also in cases such as exposure to vaccines or medications, and then physicians are accusing these parents of like shaken baby syndrome, and it may be related to vitamin D deficiency in the vaccine administration, and the parents are completely innocent, and their children are taken away from it. It's a real tragedy that's going on.
Well, I agree. But that's a different issue. But
right.
I
completely
agree.
Different. So let's get back to the molds. I'm wondering what your thought is with respect to how common it is. My guess is that for everyone listening to this who already knows they have a problem, and we'll discuss that next as to how you would understand that there's a problem, there's probably at least 10 more people who have a problem and don't know it.
That is correct. I would agree with that. Or 10 more families. Yeah.
Right. Sure. Family units. So how can one be educated? And let me just give my comments, and then you can expand on them. And I would think the first one is simple common sense is to visually inspect these areas, and perhaps you can tell us which areas would be the best to locate these. But if it smells moldy or mildewy, then there's a good chance. But if you see visual mold, then you clearly have a problem. But there's in any place that there's a water accumulation that there shouldn't be. Your home should not have excess water from indoor or outdoors. So those are the big caution principles from my view. But I'm wondering if you can expand on those and help give us the guiding principles so that we can at least educate people as to how they know they have a problem or will have a problem very shortly.
Well, like you suggested, the first step is if you have a musty odor that smells like mildew, you have a problem. Then you have to start doing basically a visual inspection, looking for signs of water intrusion. And sometimes you won't see that, but you still have to look for it. Now let's say that I walked into my living room and I could smell it, and I noticed that there was a staining spot on the wall. It could be an interior wall or exterior wall, it doesn't know. That I would suspect is water intrusion. Now, most people will say, well, I don't see any visible mold there, so I'm not going to worry about that. It will eventually dry up. Well, what happens is the mold grows in the wall cavity. So therefore, you've got to take a sample, an air sample from that wall cavity that's affected by the mold. The other trick that we're using, very common, is I use a moisture meter. Mm-hmm. And I go in and I use a moisture meter on every wall of the building or the home, mm-hmm. looking for hidden moisture. The moisture content of wood flooring, for example, should be no more than 10 to 12%. Mm-hmm. I'm finding floors that have moisture content of 48%. Exterior walls shouldn't have anything more than 15%. I'm finding exterior walls 40, 50, 60%. I was just in Bermuda a few weeks ago, and we found actually walls there in buildings that had 100% water content.
Oh gosh.
Okay, that will tell me that that is a dangerous wall.
Okay.
Then we have to look at the wall cavity, as I mentioned. The other thing that there's a fellow in Southern California. His name is Spurgeon. He's a PhD industrial hygienist, and he actually takes now swabs of wallboard where you don't see mold, and he can demonstrate the mold is growing there, but it's not visible yet because these colonies can be quite small and not visible to the eye.
Sure.
You follow?
Mm-hmm. Absolutely.
You have to do cultures. You can do swabs, of affected walls and do cultures, and you can find those. The other thing that, that would be the first step is that. The other thing I recommend is that don't rely on air samples for mold spore counts.
Mm-hmm.
Invariably, that will give you misinformation. The number of mold spores that are in the indoor environment and the outdoor environment vary over the day, like a diurnal type variation. In other words, I could go into a home in the morning and take a sample from the air, get one reading, go in the middle of the afternoon and get a different reading, and go in the evening and get a different reading. So it's not a very reliable test for what's in the air. Secondly, there are certain bacteria that do not release their spores into the air very readily, and you won't find them in the air. So don't accept somebody coming in, taking an air sample and say, oh, there's nothing wrong with this, because the indoor counts are less than the outdoor counts. That's wrong logic, because certain species of mold grow indoors much more readily than they do outdoors. So we have to look at the species of mold, not just the spores. Follow?
Sure, absolutely.
Okay.
So the recommendation is to be cautious of the indoor air sampling for molds is somewhat controversial. I find that surprising. But is there if you're going to do a mold sample, you mentioned this diurnal variation. Is it do you have a recommendation as to what time of the day would be best to sample when the levels should be the highest?
No, not really, because it varies according to humidity and wind and out of light. It's just difficult to say. You're better off doing 24-hour monitoring if you can. For example, if we take a look at Dr. Strauss's laboratory, they went in with a what call it as a Specco air sampler. They sampled for hours and then looked at the particular load that was in that air sampler and found the mycotoxins in the indoor and air. Now, if they'd gone in and just taken a quick 10-minute sample, they would have missed it.
Okay. Is this a type of analysis that can be performed by a typical mold inspector?
No, they cannot do this.
Okay, so you needed some special high-level mold expert to do this.
Yeah, and I would suggest that somebody who's doing this actually interview the person who's doing it and ask them who they're doing their work for. Or do you do it for the insurance companies? If they're doing work for insurance companies, stay away from them.
Okay.
Okay. If they are independent and say no, I do both non-insurance and insurance people, and I report the truth, then
that's your man. That's your person.
Further, find out where they are. You want somebody who's unbiased, is what I'm saying.
Sure. Excellent.
Okay. Ask them the question: do you think that airborne mold in the indoor environment can hurt you or cause toxic reaction? And the person says, "Oh no, don't worry about it. All it can do is cause allergies." Stay away from that person.
Okay.
Okay. That person is not well informed. People can go to my website. I have a tremendous amount of information on my website on all this. All right.
What's your website address?
It's www.dr for Dr. Thrasher is my last name, so it'd be Dr. Thrasher, THRASHER.org.
Okay, great. Now, you had mentioned in the evaluation phase where people can seek to understand if they have a mold problem, it was to use an instrument to find out the amount of water content in the floors or the walls. Is this
Yes,
is
yeah,
this a
that would be the first thing I would insist that the industrial hygienists do, and you walk around with the industrial hygienist if you have one there, and watch the moisture meter reading, because these all have an LED readout. All these meters do.
Sure.
You go right with them and watch it, and you can see. If you have a moisture problem, you will see it. It'll just bounce right up.
Sure.
You see a meter go to 100% like we did in
Bermuda.
Boy, both the hygienist and myself just looked at each other like we've never seen anything like this. Put your hand on the wall and it came back wet.
Yeah.
Okay.
So it would seem to me, I've actually had a number of mold inspectors in my home, so I've seen these instruments before, and they seem to be pretty straightforward. Is it reasonable for a consumer to go and purchase one of these and do the evaluation themselves in the home?
No, they're pretty expensive. You can get some inexpensive ones if you want. I think I've seen them for $85 to $100. But the ones that we use, the LED readouts, they're $500, $600, $700 for the meter.
So if you do find water in your floor or actually one of the walls, I would imagine the next step, especially if you have any health problems or you really want to take care of this, is the next step to rip up the floor or to try to find out where the water is coming from?
Oh yeah, you have to correct where the water is. You have to correct the water source. If you don't, you're going to have a continuous problem.
Yeah.
You asked me again. Let's get to the indoor environment, and I'll tell you what I do, and the people and the industrial hygienists I'm associated with what we do in the indoor environment when we go in to test for things. Number one, we do a detailed visual inspection.
Mm-hmm.
Number two, we take samples. We take swab and bulk samples. What I mean by bulk samples, if I see mold growth, I will actually cut out the growth and take that with me too. You follow?
Sure.
Okay. And then we send all these samplings off to a laboratory, and we test as follows. We culture for the bacteria. We culture for the mold. Mm-hmm. We do what we call ERMI, E-R-M-I, which is an EPA test that was developed by a group in the EPA. And this is a PCR DNA analysis for 31 different species of mold. Mm. So we run a PCR DNA, and that's very inexpensive, relatively speaking. It costs $350 to do that test. And you can come back and see what species of mold you're dealing with.
Now, with the species, is that differentiated so that you wouldn't get a broad genus like Penicillium, and it would tell you
no. For example, they do several species of Aspergillus, so they can do Aspergillus flavus, versicolor, fumigatus, etc. So there are 6 or 7 species of Aspergillus that grow in the indoor environment, 6 or 7 species of Penicillium. They actually can look at Stachybotrys, and the test, if it's done properly, can look for the different species of Cladosporium.
And just for our listeners, my understanding, elucidation is that my understanding is with some of these molds like Penicillium, there can be some species that are toxic and others that are not. Is that true?
That's right. Well, for example, Penicillium purpureginum, they say, it doesn't produce mycotoxins. Well, that's a bunch of BS. It produces one called rubetoxin A. Do you know what rubetoxin is?
No, I never heard of it.
It's a chemotherapeutic agent used to treat cancer patients.
Well, I don't use those agents, so I wouldn't know about it.
Okay, but I've heard industrial hygienists say, rubetoxin, Penicillium purpureginum, don't worry about it. It doesn't produce any mycotoxin. Well, if it's a chemotherapeutic agent and comes from a mold, it's automatically a mycotoxin. You follow?
Sure. No, I understand that. Sure.
Well, anyway, and then we also take swab samples looking for endotoxins. Mm-hmm. We also look for molds produce another group of polysaccharides called 1,3-beta-D glucans. We test for those. And we want to get a good idea of what's going on in the indoor environment. And then along with that, we will also do air sampling. Mm-hmm. And invariably, the air sampling come back somewhat equivocal, but when you start doing all these other tests, then you can expand what this indoor environment is all about.